everybody. It is Larry B. Hawkins Jr., also known as Hawk GreenRoom97. Today we have a special episode with DJ Ol Skool and Dr. Calloway. Please give brief introductions of who you are and what we got going
on. This is DJ Ol Skool here, and I want to shout out to everybody out there and let them know what's going on over here at GreenRoom97. And we're going to talk a little bit here about Dr. Calloway, which talked, I'm an old school dude, and he's my eye doctor, and he talked me into getting these cataracts. And he made me secure, because you know how us old men are. We don't want to go out and get nothing done and go to the doctor, but my boy hooked me up.
I'm Dr. George Calloway Jr., and I'm at Central Ohio Ophthalmology. I've been practicing for over 30 years at St. Anne's Hospital. And, I've had an opportunity to meet not only DJ Ol Skool, but lots of folks that have eye problems, and been able to help them so far.
Awesome, amazing. So, Don, what led you to consider cataract surgery in the first place?
Well, I was having problems with focusing in one eye and being hard-headed, and kept putting it off and putting it off. So I finally went and seen a doctor. It got worse. It got worse.
So, and then Dr. Calloway, what makes Central Ohio Ophthalmology Incorporated stand out from other practices?
Well, we're there for the patients. And so patients can usually get an appointment in a reasonable period of time. Some offices you call and you can't be seen for several months. And I don't feel that serves a purpose. We talk to our patients, so that when patients have questions, we try and answer them, and we don't just give them the old blow off, well, see somebody else or come back when you're ready for surgery, because surgery is a very important thing for people. And so we like people to feel comfortable.
So, Don, how did you find out about Dr. Calloway and Central Ohio Ophthalmology?
Well, one of my buddies, Stephen Bosley, he introduced me and told me they were the best doctor in town. And that's what I found out, because he really helped me with it, because I was fighting going, and I felt happy and secure with him. So that's how I got there, Stephen Bosley.
Nice. Thank you, Mr. Bosley.
Yes.
Dr. Calloway, can you briefly explain what cataract surgery entails and why it's important?
Well, cataract are clouding of the lens inside the eye. We all have a lens in our eye. Mostly it's clear. It usually starts out clear, although there are some babies that are born with cataracts. But as we go through life, the lens becomes more cloudy, and your vision starts to decrease. And when that happens, and it's due to the cataract, then it's time to get the cataract removed and replaced with an intraocular lens implant.
And Don, what was your biggest concern or fear going into the procedure?
Well, I have never had any surgery or anything in my life, and they was talking about doing laser. So it was kind of scary sounding. It sounds scary, don't it? Laser. But he was there with me, and at the end, and it was easy. The aftermath is a little bit more different than actually the surgery. So coming from an old dude that don't go to the doctor, they didn't go to the doctor probably till I was 60, and it's not bad at all. It was. I couldn't tell you, no pain, no gain, but I had no pain.
No pain.
Yeah, it was quick too, wasn't it? It was quick.
All right, so Dr. Calloway, what are some common myths or misconceptions about cataract surgery?
Well, the first misconception is that most cataract surgery is really not done with the laser. The laser is done for the secondary or after cataracts. But most of the cataract surgery that is done today is actual cutting surgery. And it doesn't take long to do. It is usually a 10 to 15 minute procedure. You're under what we call regional anesthesia. You have eye drops that are placed in the eye to numb the eye, and then you get a little intravenous Versed or Valium or one of the medications to kind of put you in la-la land. And before you know it, it's done.
Don, now, can you walk us through your experience on the day of the surgery?
Well, I went in, like he said, it was at 7 o'clock in the morning, which I stayed up all night, so I didn't sleep good. And like he said, they went in, they put in all these eye drops and the IV in my little hand right here. And next thing I know, it was over.
That's it. It's over.
It was over, man. I ain't kidding you.
All right. Dr. Calloway, what should patients look for in an eye surgeon?
Well, you want someone that is experienced and that has done hundreds, if not thousands, of procedures over the years. But mostly, you also want someone that also you can relate to as a person. And like I say, we try and talk to patients and explain the ins and outs of the surgery. The more you explain, the better, the fewer surprises that they have, and the better the experience. In his case, he didn't have. Can I just recap what you really went through?
Yeah, okay. Because I really don't know.
Okay, we do the surgery at a surgery center, and so you get there early. The surgery may be at 8 o'clock, but you'll get there around 6:30 or 7. And when you get there, they'll take they'll assess you and give you eye drops to numb the eye, dilate the pupil, etc. That process, and give you some Valium and Versed. That process takes about 30 minutes, but everybody's nervous when they come in. So,
sure.
And then when they go back to the emergency room, to the operating room, you're pretty much sedated at that point. And then we're talking to you the whole time. Patients are asking questions, but they don't remember it.
I don't remember none of it.
And that's okay, because it takes away a lot of the fear. And it's not unusual for everybody to be scared about the first time they have cataract surgery.
How was the recovery process?
Recovery process I was okay with it, except for I had a lot of floating. I had little bugs and monsters all around me, and finally they started slowly going away. And I'm at my 6th day now. They said it takes about 7 days. And I might right now have a little thing that seems like there's a little spider or something sometimes on my eyelash. And other than that, my eye is good and I'm seeing better and everything.
Now, this is going to get a little more personal, but how did it impact your personal life and your day-to-day activities?
It kind of messed me up because I like to go to the gym on a regular basis. He knows, he set me up on this question. You told me I can't get in the sauna, I can't get in the steam room, I can't go to the hot tub, I can't do nothing. They said 30 days?
Well, I think that the nurses are always going to give you the most conservative view, and they're going to tell you to take it easy. That's the main thing. Take it easy.
But it's important.
It's important, but usually you're not disabled more than a day or so, because you can drive the next day. And at the surgery center we give the antibiotic and steroids and all of that. We give that at the time of surgery. So that does blur the vision for a little bit. But when you compare that to most surgery centers give you drops to put in the eye on a regular basis in decreasing doses over a 30-day period. If you give a person a choice between you get this one shot now and then having to take a drop for the next 30 days, most people are going to naturally opt for give me the shot now that I'm not going to feel a day or so of blurred vision, and then you're done with it.
Could I say something? They told me I was confused because I thought I was going to have to wear a patch. They said where you had it done at, they don't put the patch on.
We don't use a patch. The patch is really was used for protection of the eye after surgery. The patch and they used to put a metal shield on the eye, And because they opened the eye up and they had stitches in the eye and the whole bit, we don't need those patches anymore. You don't need the patches anymore. And so it makes it a lot more pleasant not to have to put that patch on, not to put the shield on.
So Dr. Calloway, what advice do you have for those who might be hesitant about the procedure?
Well, the only way you're going to feel better about it is to know about it. And so that's when you come in and you get your eye exam and the doctor explains to you what the procedure is, how it works, what to expect after surgery. And usually, even though we give, I think, great explanations, that doesn't allay your fears completely. And you're still going to lose sleep the night before.
Oh, for sure.
But once you have it done and you know what to expect, people tend to do well. And the fear for the second surgery isn't there like it was for the first surgery.
Yeah, I have no fear for the second one.
So then, Don, what improvements? So you said you're on day 6 now. So what improvements have you noticed in your vision?
Well, they did my good eye first. So this eye over here is still kind of cloudy and stuff. This eye is totally clear. I definitely can see better. I just got to get used to being able to see so clearly. And this eye is still messed up. So I can't wait to get this eye done. So if it's like this eye, I'll be great.
Awesome. So, Dr. Calloway, are there new advancements in cataract surgery that make it even safer or more effective? I know it seems like you just kind of touched on that a little bit, but
well, the cataract surgery continues to evolve and improve. And so they come up with different implants to put in the eye. That's the lens implant replaces the lens that became a cataract. And so they now have multifocal implants that you don't need glasses for near vision and things like that. And so it gets better and better. And as machinery improves, I mean, they're making the incisions smaller and smaller. And so it's constantly improving. Cataract surgery today is nothing like it was when I started 40 plus years ago. And, you know, cataract surgery tomorrow will probably be nothing like it is today. It's just continuing to get better.
So Don, and this is just day 6. So far, how has it impacted your daily life as far as driving, reading, watching TV, etc.? Is it better, worse? How is that?
I'm definitely seeing better now in the eye, period. The only part's a little different is when I go out, I got to wear a dark sunglass because it has an effect on it. But other than that, I can see better at night now out of that eye for sure.
So Don, another question for you. What would you say to someone considering cataract surgery but is hesitant?
I have to go see Dr. Calloway. Because he helped me. I put it off, didn't I? Kept putting it off, didn't I?
Yeah, right.
I kept putting it off. He tried to tell me I was trying to get it to be able to straighten up with just putting the glasses on. He kept telling me it wasn't going to happen. So go see the doctor. That would be your best bet. Let him handle it.
I digress. Dr. Calloway, how can people reach Central Ohio Ophthalmology Incorporated to book a consultation?
Well, my telephone number is 614-891-7878. And they can always call and get an appointment, and we'll be glad to get them in as soon as possible.
Nice, amazing. Well, I personally want to thank both of you on the behalf of GreenRoom97 and the DJ Ol Skool show, since DJ Ol Skool is on the stage today. I digress.
Thank you.
But thank you very much for the information shared. Can't wait to get it out to the people. I feel like I personally have learned a lot just from this general conversation today, but I feel like it's something that will benefit myself and a lot of people. So I appreciate you both.
Thank you.
Yes, sir.